everyone, I'm Dr. Jessica Babbage. Let's talk about a common, often misunderstood issue, constipation, and how pelvic floor physical therapy can help. Constipation affects at least 1 in 6 people during their lifetime, and for some, it can severely impact quality of life. But how exactly does pelvic floor dysfunction play into constipation? And what can pelvic floor PT do to help? First, let's talk about what's considered normal. A healthy bowel movement happens anywhere from 3 times a day to 3 times a week, and ideally takes less than 10 minutes with little to no straining. Sounds pretty straightforward, right? But when bowel movements become difficult, infrequent, or feel incomplete, that's constipation. You might find yourself straining, going less than 3 times a week, or never feeling fully relieved. Factors like poor diet, certain medications, lack of physical activity, or even stress can play a role. But what many don't realize is how much the pelvic floor influences bowel movements. Most patients will see a GI doctor, as they should, but pelvic floor therapists can be very helpful too. So where do the pelvic floor muscles fit in? A tight pelvic floor can prevent you from fully relaxing during bowel movements, making it hard to pass stool. In other cases, the pelvic floor muscles might not coordinate properly. Instead of relaxing when they need to, they'll contract, leading to straining and incomplete evacuation. Conditions like prolapse or pain can also interfere. This is where pelvic floor physical therapy comes in. As pelvic floor specialists, we assess how your muscles are working. Are they too tense? Are they weak? Are they out of sync? From there, we use techniques like biofeedback to teach you how to properly engage and relax the pelvic floor muscles. We may also use manual therapy techniques to release tight areas and trigger points contributing to constipation. We'll also focus on managing abdominal pressure. Learning diaphragmatic breathing helps regulate pressure and relax the pelvic floor during bowel movements. Sometimes we'll also incorporate visceral manipulation, which is a hands-on therapy technique that mobilizes the organs, like the intestine, to help improve gut motility and reduce tension in the surrounding areas. Lastly, we'll give you practical tips, like adjusting your posture while on the toilet. Using a footstool can also help align the rectum, making the bowel movements easier. So, can pelvic floor therapy help with constipation? Absolutely. It addresses toileting habits, muscle coordination, pressure management, and also utilizes manual therapy techniques like visceral manipulation to help with constipation. If constipation is a struggle for you, I highly recommend seeing a pelvic floor physical therapist. Remember to also engage a GI doctor in your care, as sometimes constipation can be a sign of something more concerning. Thanks for watching. If you have any questions, please feel free to drop them in the comments. I'll see you next time.